Welcome to Healing at the Speed of Light. Every week we discuss how laser therapy is changing healthcare and how you can benefit. Now, here is your host and founder of Laser Therapy Institute, Dr. Jason Roundtree.
Hello and welcome back to Healing at the Speed of Light. I'm your host, Dr. Jason Roundtree. Good to see you again this week. We missed last week, just things have been a little bit crazy, as I'm sure they've been a little bit crazy for most people out there. But we're jumping back on this week and we're talking about nerve regeneration. I'm going to reference a study that's titled Photobiomodulation Therapy in Peripheral Nerve Regeneration, a Systematic Review. Now, this was published in June 2018 in Bioengineering, and this is our first animal study that we have done and that we have talked about on here. I like to stay focused on the human studies because that's what this podcast is all about, is using laser to help with health conditions for humans. However, there's a lot of things you can't do with human studies. You can't cut people's nerves and then sacrifice them a couple weeks later to see how things did. But those are the type of studies that have been done on animals in the past. And there's a lot of value there because we can actually see what's happening in the tissues. We can do things there that ethically we just, of course, wouldn't want to do with humans. But the gains, what we can gain knowledge-wise from these animal studies is just really tremendous. So we're going to talk about this today. Now this particular review, this talks about 26 different articles from the past 10 years that talk about nerve regeneration in animal models. And there's a lot of really good quotes out of this article, so I'll give you a few of those as we go. We've already talked a lot about how nerves can and nerve conditions can really be helped with laser therapy in humans, as far as the symptoms. This doesn't talk about symptoms quite as much as it does the actual mechanisms of how laser works. So I wanted to go ahead and give you a quote right off the top here from the very beginning of this whole article. It was observed that there are several features of laser therapy that are related to the reduction of tissue repair time and its capacity to increase cell proliferation. So not only speeding up healing processes in damaged tissues, but also increasing cell proliferation, or the number of cells that can actually grow as far as new tissues go. And when we're talking about nerves, that's very, very, very important. So what happens in a nerve injury in the first place? Well, there are several different things that can happen with a nerve injury. One is that, the actual nerve tissue can be cut. It could be crushed. It can be blocked with a chemical of some type like Marcaine. And that obviously leads to function changes. If you have a crush injury to a nerve, not only does it damage the actual axon that carries the signal, but it damages the myelin sheath too. Now, think about a nerve like an electrical wire. The wire on the inside carries the signal, and it's very important. That's your axon. But the insulation on the outside of that wire is also important to keep everything functioning well with that signal, to keep that signal intact, to keep it from shorting out, causing fires, things like that. Now, same kind of thing with human nerves, with the axons and the myelin sheath. You need that myelin sheath to really help the nerve conduct signals well, and it's protective as well. So it's very important. So when you damage that, you end up with functional changes as far as the nerve does not carry the signal correctly, or it carries improper amounts of signals, or if the nerve is cut, of course it's not going to be carrying any signals at all if it's cut all the way through. The article does talk too about something called retrograde axonal degeneration, and that is something that you can see in a lot of nerve injuries. Retrograde meaning that it goes damage kind of tends to track back up the nerve, kind of up the affected nerve. So if you have a nerve injury in the wrist or the forearm, you can actually see that kind of end up tracing back up to the elbow or the shoulder. I've even had cases of carpal tunnel that were so bad that not only was there pain in the wrist and the hand, but the pain went all the way up to the shoulder and into the chest. We actually thought it was a heart attack. Sent the poor guy off to the hospital because it really, and lots of left arm pain, and pain in the left chest, really, really problematic, and he was totally fine other than his carpal tunnel situation. That's that retrograde axonal degeneration, and it can actually be quite significant in a nerve injury. So not only damage, of course, right down where the nerve has been injured, it actually changes how the nerve works, but then it can even track back up the nerve as well. So, like I said at the top, this study is one that I think is really good because we can actually get into some of the mechanisms of how laser works. So what does happen really in laser therapy? Well, I'll give you a quote from the study. The wavelength of infrared irradiation is easily absorbed by tissues, and it affects the metabolic modifications, DNA activity, adenosine triphosphate, or ATP formation, and the mitochondrial chain. Now, that's a lot of very technical terms, but we're talking about there how the cells actually run and produce energy. So the study goes on to say the effect of photobiomodulation, or laser therapy, is due to the absorption of the photons, which that's the little packets of light energy, the absorption of the photons by cytochrome C oxidase in the mitochondrial respiratory chain, consequently increasing cytochrome C oxidase activity and therefore ATP formation. That's just saying that you can get better cellular energy production by putting light into those cells. It further on says that ATP, these little energy packets inside the cells, ATP from injured or regions of impaired blood perfusion can actually reactivate injured cells and metabolic disorders. So you can get ATP from injured areas or areas that just aren't even getting enough circulation, which sounds a lot like neuropathy. And by doing that, you can reactivate these injured cells. They go on to say that laser therapy is also related to pain relief and inflammation and prevention of tissue death to avoid the neurological degeneration process. So, better cellular energy has some really extensive benefits when you start talking about, trying to avoid ongoing nerve damage, nerve irritation, pain, things like that. They go down a little bit further into some of the mechanisms, and I'm just going to give you the highlights here so I don't drown you in the details. But they saw increased improvements in nerve regeneration of the axons and the nerve fibers, increased muscle reinnervation. So that's where the nerve goes into the muscle and can activate the muscle. So that's where you can have actually improved strength. You can have decreases in inflammatory cytokines, decreases in pain, improvements in myelin sheath thickness. That's the insulation on the outside of the nerve. So improvements in actually making the insulation thicker. You can have improved electrophysiological function, decreased inflammatory cells, improvements in the normal amounts of pain perception. And pain sounds bad, but normal pain perception is very, very important. When you have abnormal pain sensations and perception, that's when you end up with some of the weird symptoms that you get with neuropathy, those stabbing little stinging pains, the ones that zip right down, say, the whole foot. Though that's improper pain perception. You need some level of pain perception. I mean, you need to know when you step on something sharp. So if we can get the nerve back to proper pain sensation and perception, then that's going to actually be not only, less pain that you feel, but improved perception of what's going on overall. They also saw improvements in neural growth factor, or NGF, as well as improvements in neurotrophic factor expression, which is BDNF. And then also they saw increased mRNA expression. So mRNA really helps with gene transcription in the cells, and that's an important factor for healing, but also just healthy tissues in general. So some of the observations they made, those are the mechanisms, but some of the observations on this study makes in looking at all these different animal studies was that laser absolutely is effective for nerve repair, and in the animal model. Now, this doesn't exactly translate to humans, but to a large degree, we think most of this probably does. They did say that wavelength is key, And when they say wavelength, we're talking about the color of the laser. Not just any laser will work here. You need a laser that's in the visible red to near infrared spectrum, where we're talking about wavelengths between 632 and 904 nanometers as far as this study goes. So some in the visible red, but then also in that near infrared, not the far infrared, but in that near infrared zone there. Now, one of the things they noted here that I thought was really interesting is that the best studies that they had out of this collection used very high doses. So we're talking 40, 50, even 80 joules per centimeter squared. Now, that might not mean much to you, but when you're using a very, very low power laser, it takes a very long time to get that level of power into those tissues. If you're using a higher power laser, like a class 4 therapy laser, you can get that dose into the tissues much, much quicker. But that's where they saw some of the best improvements in nerve recovery, was in using those larger doses. They also said, hey, look, there's some difficulties here in using laser therapy. They said that there's difficulties in selecting the most suitable parameters for application because of the lack of standardization, wavelength, power density, irradiation time, or how long the laser is actually on the tissues, light polarization, continuous versus pulsed waves. All those have repercussions on the biological effects, according to this study. And what that means is that this is not just easy. You can't just take any laser and shine it on something that's injured and expect it to get better. There's a lot of factors here, and this study, and again, this is just 2018, this is pretty recent, they're saying, look, there's no real consensus out there on what exactly the best techniques are for some of these tissues, and these different factors have a lot to do with how well those biological effects take place. So what do you want to do? What does that mean? Well, you need somebody who's got some clinical experience with this. If we don't have some research-driven recommendations for nerve regeneration in particular, and that's what you're hoping to get from treatment, you need to get to a clinic that's very experienced in this so that they have seen this work before, they've been able to make this work for their patients. And I'll, of course, highly encourage you to look for an LTI clinic, because we have a very, very good, well-established treatment plan that we use for nerve injuries. We have excellent equipment at all of the LTI clinics, and we also have very, very good techniques. We've got a lot of this sorted out as far as the power density, the time, continuous versus pulse, these difficulties the researchers are talking about. We've got a lot of that sorted out, at least clinically, knowing what works and seeing what works, and also how to troubleshoot if it's not working well, how to make sure that we can get that patient the results that we're looking for. So I encourage you to go to our website, lasertherapyinstitute.org. Look into what we have on hand with our clinics. Look and see if there's a clinic near you. So if you want to know more about nerve injuries, how to use laser therapy to get those injuries to improve, obviously drop us a line or get a hold of one of our clinics. We'll get you the help you need. And I'll see you next week.
Subscribe to this weekly podcast for more great information. Find a certified laser therapy clinic near you at lasertherapyinstitute.org. If you're a healthcare provider, check out our practitioner-focused Laser Therapy Institute podcast. Thanks for listening.